My name is Olivia Wan, and I'm with the Law Office of Olivia Wan and Associates. Today we're talking about should you consider hospice care for your loved one? Caring for an aged parent can present a number of challenges, including juggling tasks amid time constraints and a heavy emotional toll of someone approaching the end of their life and their journey. This is particularly challenging when one's parents live far away. The number one goal is that the aged parent is taken care of and their needs are fully met. Should you consider assisted living, nursing home care, or hospice care for your loved one? Just what is the difference? Let's first talk about assisted living. Assisted living is designed for individuals who need assistance with daily living activities such as preparing meals, housekeeping, shopping. This option includes also personal care services such as assistance with bathing and dressing. Although the fee may seem astronomical to some, it's more costly to secure personal assistance in the elderly person's home, particularly in securing dependable, honest workers. So if you were to compare $4,000 to $5,000 a month versus paying for private care in the home, especially if it's 24 hours a day, you'd see that it's probably cheaper to go with assisted living. I see this as an opportunity to thrive, especially after having worked with clients who were not getting adequate nutrition at home or receiving much social interaction. Balanced meals are prepared, and the individual can either eat in their studio apartment if they want privacy, or they can dine in the main dining hall. There's lots of great opportunities if you're in my region. We send a lot of folks to charter in Paris, Tennessee. Lots of options in Clarksville as well as Murray, Kentucky. Now, let's talk a minute about long-term care. Long-term care is not merely an option. You just don't wake up and think, well, I'm going to go to the nursing home and let them take care of me. The individual must have a chronic illness or a medical condition that requires long-term care. So, to determine if the person qualifies for long term care, a functional assessment must be made. And in other videos, I discuss how to pay for long term care because Medicare only allows a maximum of 100 days. But that's another discussion. So now let's focus a minute or two on hospice care. Hospice care is palliative care designed for those who are living with a terminal illness. The goal is to relieve symptoms and so that the person is not suffering or having pain while they are dying. It's a way to preserve dignity and quality of life while living at home and not pursuing curative care. If I ask my senior clients if they would prefer to live at home or going to a nursing home, 9 times out of 10, they would prefer to stay within the comfort of their home. Now, hospice care is focused on the person instead of trying to cure the disease with the acceptance that death is pending. Medicare pays for hospice care, unlike long term care, and there's no recovery of the expenses that they've paid through the federal program of hospice. I've asked clients, what is more frightening, to die or to go to a nursing home? And most respond that they would just rather die at home. So these are really painful and challenging conversations, as you can imagine. Of course, it's not merely a matter of choice of whether to go into long term care or elect hospice care. Unlike a nursing home where they provide 24 hours a day care, with hospice care, they send the workers out only a couple of times during the week. So that means that the caregiving falls on the family. So, are you capable of offering that level of care to your loved one? So, you become a full time caregiver. My mother was in hospice care due to brain cancer. The hospice workers were absolutely amazing. We were so satisfied with the quality of care. However, caring for my mother day to day was our responsibility, and we divided these tasks among family members. And that included dispensing medication, hygiene, toileting, and so forth. We were subjected to watching her decline hour by hour, day by day. And yet, I count it as a blessing to have been with her when she took her final breath. It was such a gift to give her the gift to stay at home with her hospital bed positioned at the living room window where she could see her roses and hear the birds sing. What a beautiful thing to end your journey in peace. I served a family as a lawyer some time ago whose father was suffering from terminal cancer, and he reminded me of my mother because he was in his 60s. His choice was hospice care, and his children were distressed because they wanted him to pursue treatment. And I encourage the sons, please honor his decision and emphasize that the greatest gift that they could give him was to let him die at home, which was his choice, and for them to divide up the duties so that they could each take time off work where it didn't fall on just one of the children. So, how could they accomplish this with each of them working? As I mentioned, they took family leave with their employer and divided it up among them. So, they took turns taking care of their father, honoring his wishes. And I firmly believe that this aids a person's grief, knowing that we put our own needs and desires aside to honor a parent's wishes. In summary, be sure to discuss your medical preferences of end of life decision making with your family. Ensure that you have the right documents in place to avoid court intervention, and that includes a valid, detailed, general durable power of attorney, a healthcare power of attorney, a living will, a HIPAA authorization, as well as a last will and testament or trust. Life is a journey, and may the final chapters preserve the quality of life that we all deserve and we want. Thanks for tuning in.